Hi, this is Tina Roundtree with Optimal Research here in Austin, Texas. I've been in clinical research for 21 years now. Today I'm going to talk about the different studies we have here at Optimal, give a brief tour, and then a question and answer session. So right now we're currently enrolling two different studies, three actually. One is a birth control study, the other is a bunionectomy study. Let me just flip around. This is our lobby where you would check in if you chose to become a patient of ours. So our birth control study requires 7 visits at the facility over a 13-month period. That study pays our subjects up to $460 for complete participation. Our bunionectomy studies require 3 to 4 visits over several weeks here to the facility, with one of those being an overnight stay, actually 3 overnight stays with us. That study pays up to $1,000 for your complete participation. We also have what is called our Study Buddy program. So if you refer someone to participate in a study and they complete it, you get $75 simply for referring them. All right, let's take a quick tour. Again, here's our front lobby area and our reception area. Our receptionist isn't here right now, but you would see her bright, smiley face if you were to check in. As we come through the door, on our right are our exam rooms. We have 3 exam rooms that look very similar to this. And we'll just keep going down the hall. There's another exam room, our reception area again. Here's our 3rd exam room. Most of our screening and follow-up visits are what take place in these rooms up here. We keep going back here, and we have our surgical suite. This is where the bunionectomy procedure actually takes place, here in our facility, all in the same building. And now we'll head on back to the clinic where we would stay. We have 14 beds. All of the rooms look just like this. They all have nice big televisions and a lovely view out the large windows. And as we keep going down the hall, all the patient rooms are on the left. To the right, we have our nurses station with some of our staff. We have James. Say hi, James.
Hi.
Trish. Maria. Ashley. All right. Keep on going. Again, more patient rooms. Oops. Not made yet. We just had people leave this morning. So, let me come on over here. This is another small little nurses station and our lab back there. And again, another patient room. A lot of people ask what they will be wearing when they leave here. So this here is the boot that you get during surgery. So you come out of surgery with that on your foot, and that stays on the entire time you're here. Most people go home with that boot. Once you go to your surgeon for your follow-up visit, you would at some point be moved into that lovely little shoe. So it's up to them when to put you in that. Here again, we have a nice view out one of our windows. We also have the capability of doing many different studies here. We may even have a wisdom tooth study coming this summer, hopefully. If that is something you might be interested in, please make sure you follow our page. Continue to watch for any updates. We'll keep you posted on those. And that's about it as far as what we have planned for today. We like to answer any questions that anyone has, so feel free to start asking. Not seeing any just yet. I do have a list here that I can go over that we have had many people ask in the past. You'll just have to excuse me looking back and forth. Okay, so is the surgery experimental? Absolutely not. There is nothing experimental about surgery. We are testing the pain medication following surgery. So surgery, just as it would be with any surgeon at any facility. The studies pay up to $1,000 for your complete participation. To qualify, you first need to call our recruitment line and have a phone interview with them. They will do a preliminary qualification. Then they will transfer you to us and we'll schedule you for a pre-screening visit. Then you'll come for an actual screening visit if you pass pre-screening. Then your surgery visit's scheduled, which is where you stay 4 days and 3 nights, and then you'll have a follow-up visit about a week after that. You also have to follow up with your surgeons for several weeks, but that's at their office, not here. The size of the bunion, we're getting a few questions coming in now. The size of a bunion, it just depends. It could be too small, it could be too large, you just never know. But you have to come in and have an x-ray so we can actually take a look and see and have the doctor evaluate you. As far as any money out of pocket, the only money that you would have to pay out of pocket is for the cost of your prescriptions when you go home. Nothing while you're in-house. Can you have visitors? No, no visitors while you're here. They can come with you, see you check in, make sure you're okay, and then they have to go. They're free to call you as much as they want. You can call them as much as you want, but nobody can actually come with you here. As far as what can I bring with me? Well, you're going to be in bed for a few days, so you can bring phones, iPads, books, magazines, computer. We have lots of people set up, almost a full office here, so bring what you need to keep yourself busy while you're in bed. Let's see if I have any other questions on my list here. The surgeons. So the surgeons who do the surgery are licensed physicians that do surgeries all the time. They just come in once or twice a week and do them for us as well. They are Mark McDonald, Mark Robson, and Dr. Michael Goff. Is your insurance going to be billed? Insurance, again, would only be billed if you chose to have it billed for your prescriptions once you leave, and that's just for a pain medication. So those are usually pretty cheap out of pocket, even if you don't have insurance. Is bunionectomy painful? Well, yes, it is. There's no doubt about that. We are testing post-operative pain medications, so yeah, it's not painful while you're in surgery. You're asleep and your foot's numb. Your foot's actually numb for the whole first day, so it's after the first day when the pain will set in, and we will give you medication. You have to stay for 4 days and 3 nights. So if you have surgery on a Monday, you would go home sometime Thursday before noon. And if you have surgery on a Tuesday, you would go home sometime Friday before noon. The scar just looks like a tiny little line, about 2 inches long on the side of your foot where they removed the bunion. I did see another question earlier about a bunion on the outside of the foot, not the inside. And we do not do those. Those are called Taylor's bunions, and they don't qualify for our studies. That's all the questions I'm seeing. I believe we've answered everything. Let me just check my list. How long do, I just had a clarification, excuse me, the scar is on the top of the foot, not on the side. The side of the foot is if you had the Taylor's bunion, which we don't do. So it's on the top of your toe. Sorry about that. One other question I thought would be a good one to answer is about how long do you have to be off of work? That's a big one for people. Most people have to, if you're somebody who works at a desk and can prop your feet up, about a week is sufficient, which is the week pretty much that you're here with us. If you are somebody who's on your feet a lot, at least 2 weeks off, and then you really just need to talk with your surgeon and see what they'll allow you to do. It's a good rule of thumb to say when the stitches come out, it's a game changer. All right, not seeing any other questions. So that's it. Have a great day. Please feel free to call us. Our recruitment line number, I have that for you. If you need it, it is 1-844-797-8839. Thanks. Bye.